All right, good morning and good afternoon, everybody. I think we're gonna go ahead and get started. All right, well, thanks for joining. Today we're gonna be talking about the equity impacts of COVID-19 and some ideas around emerging responses and strategies. So a couple notes on housekeeping for those of you that are new to this software. There are a couple of options. So we'll be going through the presentation. We're going to ask that we'll hold questions until the end. But in the meantime, as we're going through, there's both a chat and a questions option. So feel free as we're going through, if you have questions, to put those in either of those two areas, and we will circle back at the end to touch on those. And then this is the beginning of a series. We did some webinars back beginning of the year and touched on equity as well, though everything looks pretty dramatically different right now. So we have some ideas for additional content that we'll be working on over the summer based on some of our work, but would love to know if there's other areas that we can focus on that would be interesting. So quick introduction. There will be two of us today. So I'm Mike Reich, I'm the founder of Seabourne and the new data platform, DataContours. So I've been doing work in the data space for about 15 years now, spread around environmental data, public health data, government data, and do strategy and data engineering work. So close to my heart is the bigger conversation we're hoping to have today around not just data, but also what are the implications for policy response. And so I'm pleased to have with me today Gwen Young, who is a longtime friend and colleague. So Gwen, you want to introduce yourself?
Yeah, good morning and afternoon, everybody. So I'm Gwen Young, and I'm currently working with Perch Perspectives, which is a human-centric strategic consultant firm, and also the president of something called Balance Up Leadership, which is aiming to balance up leadership in public and private sectors between women and men. And I come into this conversation today, though, with over 25 years of humanitarian emergency response work overseas. And so very cognizant about the role data plays into this, very cognizant about the role that vulnerabilities play, and as an expert in gender equity, really concerned that as we look both at local, national, and structural response, we take into account that all communities are experiencing these impacts differently. And just honored to be here with Mike and have worked with him in getting me up to speed on how we use data to plan responses, inform policy, and analyze problems.
Great. All right, so we're going to try and touch on three things today. First, provide a summary of some of the data we're seeing and what the quantifiable impacts are on equity issues. We're going to take a kind of a broad perspective, not just focus on public health, but also look at some of the economic and social impacts as well. The second are some thoughts on how we can improve our response. This crisis that we find ourselves in is different in some fundamental ways and creates some new challenges, but also presents some new opportunities. And then we'll wrap up talking about some ways to think about how we can use our recovery response efforts to also address the structural inequalities that are impacting the most vulnerable. There is way more content than we have time for today, so we're going to try and be brief, but there's a lot here. So I imagine we'll probably do some more in the future. Okay, let's talk about COVID impacts, and I'm going to kick off here, and then we'll hand it off to Gwen to talk about the last half. So, the top line number, and unfortunately, today is one of those milestone days where we've seen just over 100,000 total deaths. And unfortunately, this is probably an understatement. based on some of the overall mortality numbers. This is, probably up actually around 150,000 additional deaths because of COVID over the baseline. So obviously, this is almost incomprehensible. And I think we're all wrestling with what the implications of this mean, both in day-to-day people loss, but also in the ongoing impacts that folks are facing. As we were putting this together, I think what the key takeaway and the theme throughout isn't necessarily that COVID has created some set of new inequalities, but rather COVID has made and exposed inequalities that have gotten worse. And you can think of this in two ways. The people that have felt the most impacts from a health perspective or from a mortality perspective of COVID are already and have been already the most vulnerable. So there's sort of this immediate toll. But looking forward, one of the big challenges is the people who will likely be worse off in 6 months are the ones who are struggling the most today. So I think as we think not just about today's sort of equity issues, but more importantly, what do we do about it? Where are we going? Realizing that the trend in a lot of different ways is downward, and the folks who are going to be most impacted are the ones who are probably least able to successfully navigate the challenges. So some specific numbers, and this is obviously, a snapshot of where we are today, but also incomplete. There's a lot more data that we didn't have room for. But as we think about the health impacts, so you think about this in a couple of different ways. I mean, one of the main ways that we've been able to track the breakdowns of impacts has been around folks with comorbidities and vulnerable populations, both from an age perspective, from an economic perspective, and from a race and ethnicity perspective, have been 3 times more likely to die from an infection than the general population. And so the deaths overall from COVID have trended much more towards people with these comorbidities. So over half alone have been folks with hypertension and or obesity. And unfortunately, the correlation with obesity and high blood pressure are primarily within low-income and minority communities. So the total estimate would be 1/2 to 2/3 of all case fatalities are in these minority communities. There's emerging data around what the long-term health impacts are. And I think it's one of the things we're watching very closely. There's a lot of research going into if you don't die but recover from COVID, there's emerging evidence. We don't quite have strong enough numbers yet, I think, but emerging anecdotal evidence that infections are going to lead to pretty severe exacerbation of existing conditions. And so one of the big challenges that we still don't know is how much is COVID or a COVID infection going to increase healthcare needs going forward. But we would expect that for folks who have recovered from an infection, the odds of either exacerbating existing symptoms and conditions or having new healthcare needs is probably going to be higher than for folks who don't. And unfortunately, many of the people who are in these critical industries or who have been unable to shelter in place are also folks who are in those vulnerable populations. So, so the big takeaway here of all of this is, regardless of age or sex, which have been 2 of the things that early on were there's really good data around. So if you're older and men are slightly more likely to have significant impacts from COVID than women, but controlling for those two, racial minorities and economically disadvantaged populations are much more likely to both have require hospitalization and death than folks of the same age or sex. So the next piece is around economic impacts, and I think when we talk about COVID, increasingly this is more than just a health crisis. We're realizing that this has because of the response to COVID, there are significant economic and social impacts as well. And when we think about overall cost and sort of duration, the economic and social impacts that we're starting to realize today are likely to be around much longer, and for vulnerable populations be much more significant than just the straight health impacts of COVID. And so the big challenge that most folks are facing is around employment. And so over the last 2 months, we've seen just a dramatic shift. And today, the latest unemployment numbers came out. So it's over 40 million unemployed in 2 months, which is pretty impossible to conceive of. So of those, the story that's emerging is 60% are women, and largely because the industries that have been most hardest hit by layoffs and by the response to COVID have been those industries that largely employ women and minority communities, so retail, restaurants, hospitality, and healthcare. So that leads to, if you break down unemployment, the unemployment rate for minority women is 6 times, so it's at 18%, and that's probably a couple of weeks old. 6 times the rate for white men. And so compounding this is these industries are already industries where work was largely hourly, wages were lowest, so job security generally was pretty low. And now we're seeing that the impacts are pretty disproportionately felt within those industries. So and one of the challenges we'll talk about a little bit later on is, unlike other recessions where we would expect a recovery to sort of provide a linear increase in jobs across sectors, roughly equally, the challenge here is, at least for the next 6-12 months, jobs in these industries are not going to come back at the rate certainly that they were lost, and many of these jobs may never come back. I think that's what we're starting to wrestle with. So the long-term cost potentially here is huge, not just for folks in these industries, but for society as a whole. If we begin to see folks moving from short-term unemployment into long-term poverty.
Mike, can I jump in too? And I think one of the things that we've talked about and been analyzing as well too is that for women-owned businesses, their access to financing capital is also impacted. It was tenuous at best before, right? But now at this point, and so it's the loss of jobs, but it's also the loss of some of these bailout packages or these stimulus, and women-owned businesses and women-led businesses have disproportionately lower access to finance. So also from a business recovery angle, there's going to be a large economic aftershock as well.
Absolutely. So generally, there's a lot here, but we kind of lump these under social impacts. There are a number of different ways to look at this, and again, each week brings out new numbers and research around kind of what the broad non-economic impacts are. One of the things familiar to both Gwen and I's daily life these days is childcare, and so 2/3 of childcare centers have been closed for 30 days or more across the country, which I found shocking. And as we think about what isolation is doing to folks. Our friends at the Wellbeing Trust put out an interesting projection modeling about 75,000 additional deaths from suicide and substance misuse over the next 12 months. And that's probably a conservative estimate because it's about a month old at this point. You think about housing, so there's been about 110% increase in mortgages and forbearance, we're up to about almost 8% of total. The peak during the financial recession, or the Great Recession 10 years ago, was about 10%, and that happened over 18 months. So we would expect this to continue to get worse over the next coming months. And then about 30% of renters are already behind at least 1 month on rent payment. So there's been some coverage recently around overall protections against evictions that are going away, and obviously the vulnerable populations are going to be largely renters or folks who are in financial distress with their mortgage. So thinking about food security, 22% of households are food insecure, and food bank demand is up 600%. And then almost half of mothers with children under the ages of 12 are reporting food insecurity. So there's what we're calling, kind of this emerging second wave of crisis in communities that is happening more slowly, but generally looks to be in some ways more significant than what we've seen over the last couple of weeks the past couple of months with the COVID response. So the challenge for communities, both in as they're looking at where is the next 6 to 12 months going to go, is how do we deal with this? I mean, again, some of this just boggles the mind, the scale of the challenge folks are facing. And we're seeing a delayed reaction, both in reporting of the data, which we'll talk about next, but also just in the effects because of the increase in unemployment insurance has been pretty effective at maintaining incomes for vulnerable populations, but it's right now, unless something happens, it's set to expire in July. And so the thing that we're tracking and modeling is what are the implications for that shift from short-term unemployment into long-term poverty? Because under different scenarios, we see pretty dramatically different cases depending on whether folks are able to continue on some sort of unemployment or not. So one last slide here is, I think, one of the points Gwen and I wanted to make repeatedly is the big challenge here is around these big numbers that we see at the national level or even the state level, but most of these effects are local and they're different depending on where you are and even within your city. And so this was kind of an interesting visualization we did looking at Portland. The graphic on the left is highest risk populations for COVID impacts. So folks over the age of 70 with comorbidities. It's kind of an index of a bunch of different indicators. And then the graphic on the right is recent unemployment. And so you can see that this is sort of the worst case scenario where we have two huge events, the health impacts of COVID and then the social and economic impacts of the mitigation measures. And there's not a ton of overlap. And I think this is what we see is the way that we thought about vulnerable populations 3 months ago probably has to be different than the way we think about it today, in that there's a whole lot of folks today who may not have fit within that sort of quote unquote vulnerable population definition, but are probably there today. I mean, their financial resources are stretched, they're in industries or unable to get rehired. So they're going to be much more susceptible to future shocks going forward. Ultimately the response ideally is coordinated at a national level, but The policy response and the way we think about it, I think, it has to be tailored to local conditions and has to be tailored to better data. So thinking about improving our response and how we do this, I think the top line takeaway here is it's an opportunity to use this time to make progress towards some of these structural barriers to equality. So if we're going to address short-term needs, we ought to, and I think we have to address some of these long-term structural changes as well. So some recommendations and some thoughts we had from some of our work. The first is around data. So data is really everything and helps fill out this picture. And we need better data, we need more data, we need it disaggregated for vulnerable populations. And we collectively, as agencies, as governments, agencies, health departments, health systems, need to think about how we can collect and provide data much more rapidly than we're used to doing. 12-month time spans is not going to work. We need this hyper-local visibility. And, broadly, I think we need to recognize that general data points hide the individual experience, which for a lot of folks is terrifying. It's this binary right now of if you're affected in some pretty dramatic, significant, life-altering ways. So I'm going to turn it over to Gwen to take the last half of this.
Thanks, Mike. And I'm very cognizant of the time. So I think a couple of the big takeaways as well is you need to coordinate and align. So often when we think of emergency response or we think of responding to these, we think of sort of just the private sector or just the public sector or just the business sector and not looking at social and health impacts. So one is you need to coordinate and align. And as we're thinking locally, that's very important as to what churches are doing, what food banks are doing, as well as what the government's doing. So City of Sacramento, for example, is using some of their government grant to pay restaurants to prepare and deliver food to seniors. And that is a very sort of coordinated and aligned who does what and working together across both sectors. The second thing is to plan for scenarios. So what we do today can impact what happens 6, 8, 12, and 18 months out. And as we know, we're in this for the long term. We don't really know because we don't really kind of know what's going to happen, but you can't just sort of respond today. And this is a common theme if you follow disaster recovery and hurricanes is you've got to meet some of the immediate needs right first, which is, food, shelter, healthcare, but you also have to think sort of long term. And that's where we really want to look at these vulnerable populations. In places like Houston and New Orleans, they've been hit now, it's hurricane season, they're going to get hit again. So what does that mean in terms of scenario planning? What does that mean in terms of the needs that people have? The second thing is you really have to focus locally and you really have to look on a city by city level because that's where people, live. That's where people are experiencing these equities or inequities. And you have to really, partner and focus with local organizations. It is impossible for national and some of the larger ones to ignore what's going on. And going back to one of the points we were talking about earlier about data and individuals is you really have to look down to the zip code level, what's happening in each community, and think very clearly about how it's impacting each segment and facet of the community. Go to the next slide, Mike. The other thing that's really important, and if you all have been following some of the sort of global news briefs and so forth, is communicate, right? So part of it is you need to share information. You need to share information on what's going on. You need to share information on what's being successful. Where can you get your services? What does it really look like? And that's a big challenge with media and social media, but regular briefings in the countries that have controlled the spread or some of the countries like Finland, which are really working on how to kind of bring the economy back. It's about communication and daily briefings. The other thing is to be able to iterate. So as we're learning about what works, as we're learning about the impacts, is you have to come back and iterate. You have to be able to make changes, and you can't just sort of stay on one path and say, this is the only way to go. And I think we learned some of that in 2007 and 8. And the second thing is, be open to increasing new partners in new places. And there's, a variety of ways this can happen. But in the international sphere, I always talk about how Jose Andres came in with Puerto Rico and really kind of helped change the landscape, but was kind of a new partner and a new person in the space. And that's important in this context as well, because there are these health, social, and economic impacts together. And so you've got to have new partners and new ways to respond to those. So one of the things we thought we'd do is look at sort of the women in work, right? Because this is really impacting women in terms of unemployment and where they sit in these critical industries, right? So as we laid out earlier, women are more likely to be out of work. They're more likely to be risk of healthcare impacts and health impacts because they are in healthcare. They are in retail, they are in grocery stores, they are in quite a few places. But also as we go back to work, women, and I'm one of those, right? As we go back to work, you've got housing, transportation, childcare, you have a whole host of barriers. And so how can we ensure that as we're recovering and as we're building out these grants and access to finance and building jobs, we're paying attention to the reality that women in the workforce face. So that's the challenge. The immediate need is that, in places like many cities, right, they have recall and retention ordinances. Somebody has to come back. They have to offer the job to the person who held the job before. You have to keep jobs at same qualifications and level. But what we know is that some of these jobs, as Mike mentioned, are not going to come back, right? And the second thing is that some people are going to be unable to come back to work due to some of these structural inequalities. They may have health problems. They may lack access to healthcare. They may have childcare problems. Hunger and feeding their family programs. So how they come back to work and how they enter the workforce is going to be different. And what those kinds of jobs look like are going to be different, right? So we're hearing, at a big level, well, maybe more people will telework. Some people will not telework. What are people doing with their office space? But what do these jobs look like? So some of the immediate needs has to think in, and we often talk about this in the work I used to do globally, which is you need some income support, you need some finance, you need some food support, right? You need to be able to get that. You need housing and rental support. You might need your rent deferred. As much as you need your student loans deferred, your rent, your mortgage, and other support so that you can sort of stay put and be fed and be healthy so that you can actually go enter the workforce. So there's an opportunity here, though, as we look at this to re-employ people, right? So as the job change, as we're looking at more flexible work arrangements, as we're looking at how these industries are going to evolve because of COVID and continued in response to, right? Some of the industries that are the longer term recovery, not just the airline industries, but our ticketing industries, sports industries, how do people recover from this? There's an opportunity for these new jobs, right? And there's an opportunity to create working arrangements that will take into account people's skills. There will be a retooling of some of the workforce, right? When the manufacturing jobs declined 20 years ago and technology came in, certain countries like Canada and others in certain states did a really good job of sort of retooling people. So there's an opportunity right now to create not only new jobs, but new business arrangements and the hours that people work and flexible and work times. And that's been sort of gradually increasing over the past 10 to 20 years. But I think right at this moment, what you're hearing people saying is, wait, we might need to rethink. Do we need the big office space? Do we need the long commutes? Do we need people in the office? How much can people telework? But let's be clear, that's not in all industries as well, right? That doesn't solve, a healthcare and education industry and retail. So we have to think very, very clearly about what these jobs are and how we're entering people. And this would give us a chance to address these structural inequities in terms of women of color and minority communities as how we're integrating them into the workforce. Do you have another slide, Mike? So one of the things that we've been talking about is how, this is sort of this laundry list, if you will, to do, right? So one is, just to tie this up again, you need to address some of the immediate needs. We need to think about bailout support, but not just for kind of the formal jobs of informal and temporary, the people that are temporary laborers, the people that are part-time, more people that are in unpaid, but also paid work. And how do we support them? As we talked about, rehiring doesn't work. So what does that look like? How are we retooling people? Where are we putting what types of jobs are available? We need to encourage entrepreneurship as we shift into new models. That entrepreneurship for me, though, goes hands in hand with providing finance and access to finance. I mean, one of the startling figures kind of in the women's space is that, only 20% of women-held firms have any sort of venture capital backed funding. And if they're women-only firms, that's 2.8%. Meaning that money and in the sort of venture capital space is not going to women firms or mixed firms with women at the highest levels. So we need to think about that. So this is going to impact how we're looking at the recovery from this and who's getting those types of loans. The other thing is you really need to think about the things like childcare, healthcare, hunger, and housing. People have to have their basic needs met. They need to be sort of secure in those things in order to be able to go back to the workforce. And, again, there's national response is important, and really trying to get this right at a national, big systemic level is important. But this is really going to be felt at a city level of how your bus system is operating. Los Angeles has converted public rec centers into childcare for essential workers only. So that's great. So for the essential workers in Los Angeles, they get a stipend and they have a space where childcare can happen in community rec centers, which is a repurposing of the space. But more important attention focused on the role that childcare is going to play for these workers. We have to think about that across the industries that are not essential, and as various types of business are opening, startups, smaller businesses, bodegas, and the like. Mike, I want to talk about this, and then I kind of want you to jump in on this. This is our different way of just sort of bucketing the types of responses that need to take place. So we need income support. We need free childcare. We need education and training. We need specialized grants and funding. And that I want to go into that too. That has to be a blend of both public and private. So often in the cases, private sector only, but the banks, the governments, and the public sector have to come together and figure out how we're going to make these grants, who we're going to give them to, and how we can blend the financing. In the global world, these are called, development bonds, social impact bonds, donor advised bonds, but we need to think very clearly about how we're investing in these. The other thing is looking at procurements, preferences, marketing, awareness, and then really looking at how we're going to address this housing and hunger issues as well. So in order to get women back to work, minorities, communities back to work, these are all the building blocks of what you have to do. And these are also somewhat phased and have to be iterative and have to continue over time. Mike, I'm going to let you jump in on this as well.
Yeah, I think the big picture we're hoping to communicate, and I think there's emerging sort of consensus around coordinated strategies. So as you think about, if you're a funder or a health department that's looking at how to address some of these near-term impacts, it's sort of a two-for-one. Addressing those near-term impacts requires addressing some of the social determinants of health, for example, which would necessitate a more strategic focus. And so as we think about women in work, starting off with some of those initial, how do we keep people with some amount of income? And then as time progresses, how do we begin to think about and roll out these strategic priorities? Obviously, this needs a coordinated, collaborative, multi-stakeholder approach. And so as moving forward, thinking about the combination of data to help identify within a community, where are the impacts, which populations are most impacted. And then, this is a great opportunity to create a sense of urgency and momentum around these bigger structural issues. So this is an example of what a more comprehensive approach and strategy might look like over 18 or 24 months. But I think with any of these large-scale questions around equity and disparity within healthcare, within social and economic factors, this kind of approach is the one that we have a real opportunity right now to make successful. So,
Mike, can I kind of the last pitch too on this is as we're looking at these approaches, Mike and I have talked a lot about what the structure of the approach, how you approach it, what you do, data communication. One of the things that's really important, and I would be remiss for those of you who know me on this call not to mention the fact that who is making these policies, who is designing service delivery, and who is looking at has to be balanced in terms of gender, in terms of race and ethnicity at the local level as well, because it's very easy to forget what this looks like in all communities if you don't have those communities sitting at the table, right? So as you're the city of Dallas, who's done a good job of this in setting up 2 new commissions to mitigate the impact of COVID, you need to think about who you put on those committees, who's heading those committees, so that you have a comprehensive view of what your society looks like and is experiencing as you mitigate through COVID as well. So just as much as how you do it and the types of policies are important. It's who's designing those policies and how you're thinking about the response. And that really is that sort of everybody at the table mentality. Sorry, Mike, I had to jump in on the women's leadership piece.
I love it. All right, well, I think we're a little over time, so we'll shift gears here and give the promised 5 minutes for questions. So if you have a question, feel free to enter it in the chat or the questions box. So there are a couple in here. So Sophie, you've asked a couple. So yeah, we'll send out sources and the slides after this call. So if you registered, we've got your email address, and we'll go ahead and distribute that for everybody. And then next question, are there some concrete things that regular citizens who are not feeling impacts very terribly can do to further equitable, plausible responses? That is a great question. I mean, my first answer would be vote. I think that's the terrifying thing about this fall is, we have an election coming up, and one of the biggest challenges I've seen in response and even acknowledgement, has been public officials. So I would say if you're in a place where voting could make a difference and give you an opportunity, that would be the first place. Otherwise, a lot of the traditional things like volunteering and social engagement, we're in a new world, and it's hard to say exactly, where's the one place that you as an individual can contribute. So, that probably itself is a topic for a whole other webinar.
Yeah, can I jump in on that too?
Please.
For those on the call, there's a new website out there called The Power Of, which is power-of, which will help link you up to types of opportunities in communities and types of, whether that's volunteering, whether that's giving cash, whether that's helping think through. I live in Arlington, Virginia. There's a fair amount of public hearings, go if you feel comfortable leaving the house and can go to those, providing your input. There's a lot to be about advocacy, getting this data out there, trying to understand it. But there are some movements in and trying to kind of link the normal average citizen with
I think we might have lost Gwen there. All right. Any other questions or thoughts? Okay, so do you have any examples of communities that have worked to hold their public health agencies accountable for not reversing public health orders, since it seems like so many policies are being rolled back because of political pressure? Gosh, that is a great question. I think, I don't have any anecdotes. I think this is obviously a very complicated issue. And the tension between elected public officials and public health agencies is a real one. So, I would imagine we'll continue to see more direct action on both sides, given the lack of consensus around some of these public health measures. And unfortunately, as from a data perspective, and a policy perspective, the choices over the summer are going to get harder and harder for these public health agencies because we're probably going to see a slow burn with small peaks and some amount of enforced social distancing that turns on and off depending on what the level of infection looks like and then the upcoming unknown for the fall as the weather turns and people go indoors more. So I don't have a great answer for things I have seen, but I expect and anticipate we'd see a lot more activity there.
And I would encourage in looking at, we will see a lot more activity. I know one of the things on the plates of mayors is also how to handle protests, how to handle sort of people's political views, if you will, of programs and services. In the little bit that has started and we're seeing is places like Cleveland and some others are really starting to kind of have a good community dialogue and get some trust for both implementing policies and the public understanding what those are. But those I know are on the mayor's briefings and as people are going forward. And I think, if you want to watch some models that are working or not working, looking at some of those smaller cities and following the sort of Dallases and Clevelands, a couple that I've looked at only briefly, I want to be clear, will give you an idea of what's happening. That is a much bigger discussion globally on sort of a Helsinki, Finland, and Sweden, and I've been on calls globally. But I think for the U.S., we're just starting to kind of see how people are handling this and get some of the policies out there. So as Mike said, I think this is going to evolve and something we all want to keep an eye on.
Great. Any other questions or comments from folks?
Great.
Okay. Well, I want to extend a big thank you to everybody for taking the time. Hopefully this was helpful. Would love to know if there's additional content that would be helpful that we can put together, or other topics that you would find interesting. Otherwise, as mentioned, we'll follow up with the slides and sources for the data in an email to everybody. And you should get an email at the end of this with a link to the recording of the session. So feel free to send that out and share it with anybody else. So last and finally, a big thank you to Gwen for joining us and for all the great thoughts and perspective. It's been a pleasure. All right. Thank you, everybody.